Great, thank you. Welcome, everyone. I am Dr. Sharon Neeb, and I am the Program Director for the Injury Prevention Research Center at Emory, which is sponsoring this webinar today. And we're very excited to have our moderator and speaker, Dr. Briana Woods-Jaeger. Welcome, Briana.
Thank you.
You're welcome. Briana is assistant professor in the department at Rollins School of Public Health in the Department of Behavioral, Social, and Health Education Sciences. Dr. Woods-Jaeger's research focuses on partnering with communities to reduce and eliminate health disparities associated with stress and trauma, using a social ecological framework and community-based participatory research approach. Her research has examined how social, cultural, and structural factors influence mental health and health risk behaviors among children and adolescents exposed to trauma and chronic stress, and the development and implementation of trauma-informed, strengths-based interventions to reduce health disparities. Thank you so much for being with us today, Briana. And with that, I'm going to turn this over to you.
Great. Well, thank you so much for having us. I'm really excited to be here with my team, who I will introduce shortly. And we're going to be talking about a pilot study that we conducted over the past year, examining the psychosocial impact of COVID-19 on undocumented Latinx immigrant families. Next slide, please. So this is the Emory team who's been a part of this study. And I just want to shout out our amazing graduate students who really carried this study and have been instrumental in making it happen. So the co-I on the study is Emily Lemon, who's a doctoral student here in BCS, Tiffany Rimpro, incredible project coordinator of many studies, including this one. And then Liliana, Chacón, Myra Sains, and Yesnely Flores, who you'll hear from later today. Again, a tremendous graduate research team that really made this happen. Couldn't have done this without the entire team. Next slide, please. And then we're also extremely fortunate to partner with Familia, which is an extremely powerful community-based organization here in the Metro Atlanta area, who I was fortunate to get connected with a couple of years ago and have just really been so impressed by the work that they are doing in the community as a model really for how to serve families in so many different ways, but also really focused on mental health and supporting strong families. And so we'll get a chance to hear from Carla, who I'm so excited could join us today. A little bit more later as well. Next slide, please. So just wanted to orient to our approach for this study. We used a community-based participatory research approach. And what that really entails is equitably partnering throughout the entire study. So really from the identification of what we're going to focus on in terms of the research topic, through all the processes and procedures that we do to conduct research, and then including in the dissemination phase, which is what we're currently entering into, which is not only academic dissemination in journals and presentations, but also really thinking about community dissemination. And we were fortunate to be able to already do some of that earlier this year at a Latinx Summit that Familia co-hosted, and we're looking forward to many more opportunities. Some of the really important things with CBPR is that you are focused on mutual ownership of the research process and products, and we'll talk a bit about that today, as well as having transparency and shared decision-making. So ensuring that you're having ongoing communication at each stage of the research study regarding the decisions that you're making, not only in the process, but then how you are going to use the findings. Co-learning and capacity building has been critical throughout this project and CBPR in general. So really looking at learning from each other. We all bring unique strengths to the table. How can we leverage those strengths in order to really further the research and action that we're seeking to implement? And then having that balance between research and action. And we'll talk a bit about that today as well. Next slide, please. So the study aims were to examine the association between COVID-related stressors and parent mental health, as well as risk for child maltreatment among undocumented Latinx families. And we really wanted to better understand this community and population because they are under-researched, but also really underserved by the field at large. Now, Familia is a tremendous partner who has been serving this community very well, and we'll hear about that in the study findings as well. But really, we need to do better as a field and understanding what are some of the unique stressors, but also the protective factors and strengths within the community that can be leveraged to address some of those risks. So we were interested in looking at all of those things and really wanting to identify targets for intervention through the study. Next slide, please. So just a little bit more about our CBPR approach. So Surf Familia joined our study team right at the beginning of the summer. This was a rapid response study, so everything moved very quickly, which is a little bit counter to CBPR in some ways because you really want to take your time. Fortunately, we already had this partnership developed, and that's what really allowed it to run so smoothly. So we had built that relationship and really understanding ahead of time, again, to even identify what we were going to focus on in the study. But Surf Familia staff dedicated their time to the study, completing city training, joining our IRB, and then getting trained in recruiting, consenting, and administering the survey. There were regular check-ins between our team and the Surf Familia staff throughout the study. And again, this was a rapid response, so things were dynamic and changing, and so that communication was critical. Our goal was to recruit 150 participants, age 18 and older, who identify as Latinx and have an undocumented family member or are undocumented themselves. They also are clients of Surf Familia. And we recruited from 4 Surf Familia sites in the Metro Atlanta area, as well as 2 satellite locations. The survey, which we'll hear more about during our panel discussion, was developed in partnership and was delivered in Spanish. Surf Familia staff, it was a self-administered survey, but Surf Familia staff oriented participants and set them up with either red cap or paper surveys to complete, take about 30 minutes or so, and there was a $30 incentive. We also did interviews with frontline workers, which we'll also hear more about, and those were conducted in English or Spanish, depending on the preference of the participant. They were audio recorded and field notes were taken, and participants for that part of the study also received a $30 incentive. And we're now in the data analysis and dissemination phase. So both quantitative and qualitative data analysis and doing a member checking process throughout, where we're really reviewing the findings with our community partners and stakeholders to ensure accurate data interpretation, particularly for our qualitative data, but also thinking about how we're going to translate these findings into action. Next slide, please. So this is just a snapshot. I'm going to give real high level overview of some of the findings, and definitely we can talk more during the panel. But we had 145 participants in the survey portion of the study. 89% identified as female, 62% married or living with a partner, and 89% with an income of less than $30,000. You can also see here the average age was about 40, number of children 3, with 2 born in the US, and 88% were uninsured. Next slide, please. So what our primary outcomes looking at parent mental health were depression, PTSD. And what you can see here is that 63% of the sample has symptoms that indicated a depression diagnosis on the screener that we used. And this is high, much higher than national samples. And then PTSD also, 37% of the sample had symptoms indicating moderate or severe PTSD. So we definitely saw a high burden of mental health problems within the population. Next slide, please. Looking specifically at COVID-related stressors, and we used some of the stressors that had been early on identified by CDC as some of the primary COVID-related stressors were the ones that we assessed, and participants experienced an average of 2 of these related to the COVID-19 pandemic, with 42% of the sample experiencing 3 or more. And you can see they range from not having enough money to buy food or pay for rent, being an essential worker, and having insufficient access to transportation or not having a place to sleep or stay. Next slide. With this study, as I mentioned earlier, we're really interested in what might be some unique risk and protective factors. And so we looked at perceived immigration policy effects as one of those potential risk factors, really thinking about this from a structural racism framework. So some of the PIPES was the scale that we used to assess this. And when we look here, we just sort of see what was endorsed pretty highly in this sample. So in terms of the different subscales that this measure assesses, high threat to family was 76% of participants reported this. And this is concern for your family's safety, fear of family separation. So this was extremely high. Along with that, high child vulnerability. So worries about the impact of immigration policy on child safety, fear or emotional or academic problems. So how that's impacting the child. High social exclusion, loss of liberty, social isolation due to fear of deportation, safety, or stigma. We had 36% of participants reporting this. And when you think about this, COVID-19, we know also increased folks' social isolation. So this is on top of that. And so really thinking about that added burden. And then high discrimination, which refers to discrimination based on language, ethnicity, and it could be in multiple places at work, public services, public spaces. And we had 13% reporting that. Next slide, please. And then in terms of protective factors, we also wanted to look at strengths and what were some of the protective factors in the community. And what you can see here is that participants report an average of 3. So that's, we were high in terms of thinking about the protective factors that participants were experiencing, with 71% reporting they experienced 3 or more. And these range. So receiving food from a community organization, I just want to emphasize, and we'll hear more about this, the power of community-based organizations during the pandemic. We definitely saw that in this study. And when we think about intervention points where we allocate resources, I think this is a really important point. So you see 89%, that was where they went for basic needs. Relying on spiritual beliefs was also very high in this sample, as well as family and friend support, and having access to culturally responsive services. Next slide, please. So then just a snapshot. So as we're thinking about the association of COVID-related stressors and policy perceptions with some of our mental health outcomes, we were expecting COVID-related stressors to be highly related to these different mental health outcomes during the pandemic. But what we saw was that perceived immigration policy effects were really driving the mental health concerns we were seeing in terms of being associated with those. So this is related to depressive symptoms. And then if you'll go to the next slide, please, you'll see a similar pattern in terms of related to PTSD symptoms. So perceived immigration policy effects had a strong association, and you can see the different subscales there. However, we did not see an association, a significant association, I should say, with COVID-related stressors, which was something that we were surprised by, and we can talk more about with our panel. Next slide. And then finally, we're in the process now of analyzing our qualitative data. So there's much more to be learned, but I wanted to just give an overview of some of the things that we're looking at. So we've seen other researchers have documented that COVID-related social isolation in particular and economic stress are risk factors for child abuse and neglect. And so wanting to understand how is this experience among undocumented Latinx families during the pandemic is something that we want to look at with our qualitative data. Next slide, please. And I'm just going to provide 2 kind of high quotes and just to sort of frame some of what we're seeing. But like I said, we're still in the process of analyzing this data. So when we think about social isolation, economic stress, and how that impacts parent mental health, one quote reads, "Yes, many say that all these situations have generated a lot of stress and or depression, or that someone in the family has just been deported, for example, a member of the family. So in addition to that, they cannot go out and are affected by COVID and are at home. And for example, many landlords are like putting pressure on them that they're going to kick them out, that they're going to evict them. So this creates a lot of stress, a lot of anxiety, and also sadness." So I think what you can see here is just the compounding of stressors. And again, you see the immigration policy effects in this quote. Next slide, please. And then we think about in the relationship to family violence, another quote, I'm just going to read this one as well. "Because we live in a society where, one wakes up, you go to school, and one of the things that has caused the increase in domestic violence is just that because being stuck inside, that is like a new normal, that the kids are in school or not in school, they're home all day, the pressure and the stress of putting the kids to do classwork, to do homework, too many things that they are dealing with. Perhaps the dad lost his job and cannot work, he's infected with coronavirus, whatever." So again, you can see these compounding stressors all operating at once, a lot of pressure and stress, this potentially putting families at risk for increased family violence. Next slide, please. So I'm very excited. We're going to be turning it over to our panel soon to hear from them. But I do just want to highlight some of the next steps that we're planning. So in regards to the findings that we've had, so one thing is we want to analyze more about the community protective factors. So really understanding how are they influencing parent mental health and child maltreatment risk during the pandemic. So our next set of analyses will be focused on that. We are planning to submit a grant to test a multi-level intervention that involves promotoras delivering a strength-based parent-child intervention that's adapted to address ethno-racial trauma with undocumented Latinx families in the community. And this is really in response to what we saw with immigration policy effects around child vulnerability and threat to family, as well as what we know in terms of the importance of the parent-child relationship and some of the unique stressors that families have been under during the pandemic. We submitted a grant to test a community level intervention that focuses on building more critical consciousness, cross-racial solidarity, and connectedness to really empower communities around resistance to structural racism. We're looking at doing this with several community partners, including Familia, and really thinking about this, again, responding to some of what we've seen around how structural racism is playing out for these families through immigration policy. And then finally, developing a policy brief to really highlight the negative impacts of immigration policy on mental health during the pandemic. So when we think about mental health interventions, often we go to more of the clinical interventions that we deliver and starting to really recognize the potential of policy as a mental health intervention and what we can be doing to provide that information for folks. All right, so I am now going to turn it over to our fabulous panel. Again, we are so fortunate to have our community partner represented here through Dr. Carla Santiago, Liliana Chacón, and Yesnely Flores, who are two graduate research assistants who, as I mentioned before, were instrumental in this study and are part of the Thrive Research Lab. And so what we're going to do is that I have a few questions that I'm going to ask them to just respond to, really reflecting on some of what we learned during this study. And then we definitely want to open it up to the audience to hear from you all, answer any questions and have discussion. So with that, I will start by asking Carla, as a Sur Familia staff member, I'm very curious what you think about the study findings and anything that maybe surprised you from the study.
Well, first, thank you so much for the invitation to be part of the panel today. And I am very grateful to be part of the collaboration with the pilot research. So while the virus has disproportionately impacted the Latinx community, exacerbating, pre-existing inequities, what surprised me the most about the results of the study was that the results confirmed that many participants acknowledged being experiencing depressive and PTSD symptoms, but these were not related to the high level of economic, food, or housing insecurity due to the COVID-19 pandemic. What was not a surprise for me, and based on my experience working with the Latinx community for the past few years, is see how the perception of a limited statewide immigrant policy is associated with a higher level of depressive symptoms and PTSD symptoms for the Latinx community, especially our families here in Georgia. So the surprise was not seeing that connection with the depressive and PTSD symptoms and the COVID stressors, but it confirmed how the immigration policy, it is affecting the mental health of our Latinx community.
Thank you, Carla. Yeah. And kind of building from either what surprised you or just sort of what you think we should be focused on, like moving forward, what other topics do you think we should be studying when it comes to mental health and violence prevention?
Mm-hmm. Well, future research to test the long-term effects of the pandemic. And adding this to the perceived immigration policy and how this is affecting the parents with this elevated stress due to the pandemic and the immigration environment. And also explore how parents with this elevated stresses and the occurring anxiety and PTSD and depressive symptoms could be a predictor of family violence, specifically child maltreatment potential. So that I would say that going to that line to see how the cumulative stressors is affecting the way our Latinx parents is reacting to the many repercussions of the COVID-19 and also the immigration policies in their parenting or their family environment.
Absolutely. Thank you.
Thank you.
Yeah. So Lily, turning to you now to just ask a couple of questions about your experience in the study and really partnering with Sur Familia in the process of developing and conducting the survey. Just wanted to hear some of your thoughts about that process.
Yeah, thank you for that question. I mean, you alluded to this a lot in the presentation and just how wonderful Sur Familia is as a partner. Throughout that whole process, it was very collaborative the entire time. And I think something that is just so great to work with community partners like Sur Familia is that they are also so invested in this research that they also bring them their full selves. So if we had certain questions that we wanted to ask, they were always very open and saying, can we rephrase it, or can we reorganize the structure of when it's going to be asked? This could be a little too sensitive to bring up front. So I think that that part in working with them was just very easy, and it came very natural in all of our team meetings. And we met very frequently during the summer of 2020. And it wasn't just a survey development, but I think it was all aspects of the research and really working with them on what protocols are we going to use together to do this study. We were under COVID. Last summer was a lot. So really thinking through how are we going to collect data in person and having backup and listening to our community partner and them saying, maybe everyone might not use the iPad, so let's also have paper, and having protocols set in place for paper surveys and double data entry on our end. But yeah, working with the Familia was just so easy in the midst of such a terrible time. But I would also say their flexibility and having to deal with our systems as well. I know that in the beginning with developing the survey specifically in REDCap, sometimes our systems aren't created to work with diverse populations. So having to navigate converting our REDCap data entry system into Spanish so that our community partners can use them. So thanking them as well for their flexibility with having to wait until we were ready. I don't know if that answers your question.
Oh, no, absolutely. And I just want to echo and the fact that they were doing all the frontline work and this, right? And how much that was on top of all of the amazing work they're already doing. So I completely echo what you shared, Lily. Thank you. So Lily, another question so one of the things that we saw with just the participants is that we had the majority were identified as female. And just curious about your thoughts about how that impacted the study, either the findings or what you think went into that being the way it ended up in terms of our recruitment.
Yeah, and I would like to open this up with the rest of the panelists, just and everyone else who was on the study. I did think it was interesting that we most of our participants were women, and like Carla said earlier, just the findings of how open they were to discuss mental health. And this was an unrelated study, but I brought this up in past meetings of I was conducting a different study, but involving mental health with the Mexican consulate. And whenever we tried to recruit men in that study, they were very vocal and saying, I don't have time to be sad. I don't have time to think of my depression. The cost of meat and beans are going up, and I just need to think about that. So also looking at how gender plays a role in how we ask questions in the community as well.
Thank you. Yeah, would the rest of the panel like to share any thoughts about my question?
Yeah, I can just add, I think it's a lot of like cultural norms of how, man, it's like a provider specifically in like an unprecedented time like this, like where things are just being just compounded with stress and anxiety. So, and then like women really having to, or Mexican women or Latinx women having to really take the role of like providing in an emotional capacity. And then I believe, and it's an assumption, right? But that being asked to participate in that survey kind of is like a small relief of like, I'm finally getting able to talk a little in regards to what's going on. So I do think that cultural norms really came to play. I think the big question is like, how do we address those moving forward so that we can get more male participants and really understanding what their process is?
Mm-hmm. Thank you. Carla, do you have any thoughts about that?
I agree with the rest of the panelists. Yes, in our agency, you will see that the majority of the clients that come to seek our help and benefit from our resource is women, most of them, yes. And yes, I would love to see a more equitable population here, to see more men involved in their family's process and to seek help when, for their family as well, not only women, but men.
Yeah, that's really important for us to think about. And I appreciate what you all are sharing about just thinking about different cultural norms, how we ask questions, how we even frame the study, all of these things, really being thoughtful about that and who that may be excluding and for what reasons. So I think lots to be learned about this, and I think another future direction for us to consider, absolutely. All right, Yesnely, I have a couple questions for you, and then we're going to open it up for everyone to ask questions. But Yesnely, I know you've worked a lot with the qualitative data, so I wanted to hear any advice you have for students or researchers in general conducting qualitative research in partnership with communities.
Yeah, I would say the biggest thing that really helped me is, while I'm an expert of what I do, I am not an expert in regards to like the community itself. Like I am there to just take everything in, and they're experts of their community because they're there every single day. So really going in with these interviews in mind that like you're there as a sponge to just take it all in, and just make sure that like elevate their voices in which manner that may be. I found it very, very helpful just to go in knowing that like I don't know anything, but they do, is my biggest advice.
Really being open, it sounds like, to learn. Absolutely. And then in terms of what, so far, I know this is an ongoing process of analyzing the qualitative data, but what are you most interested in sort of further exploring, or sort of next steps you see based on some of the things we're finding with the qualitative data?
Yeah, I think since I was able to do a majority of those interviews, one of the like trends that really popped up were the fact that while COVID was very stressful, like undocumented Latinx families already have a lot of trauma, whether it's pre-migration, migration, and then after migration. So it was just like, they were kind of numb to the COVID itself, from the interviews I was hearing. So what I really took out of that, and what I'll be working on my thesis, is like the effects of intergenerational trauma due to policies on mixed status like youth here in Georgia. So really understanding how the trauma of our previous generations have affected us as youth, and how it will affect the generations to follow due to like structural racisms or the cultural aspects that come to play.
Thank you. I imagine there may be some questions around your thesis topic, so thank you for sharing that. We're really excited for what we're going to learn through that as well. So I'm now going to turn it over. I believe Myra and Tiffany have been sort of monitoring the chat for questions, and so I'm going to turn it over to you all to sort of ask our panel or have more discussion with them around what you've been seeing in the chat.
Sure. One of the first questions that was brought up was just thinking about, did the participants mention specific statewide policies that were particularly harmful? And so there's been a little bit of chat that Lily and Myra have been able to address, but I don't know if we want to speak a little bit more intentionally for those who may not have the chat.
Yeah, I can add one of the policies that really was mentioned was the inability to have a driver's license, and how that's very much like very stressful, because it's like just going to your job is like putting you at risk, or having to drive your kids to school is putting yourself at risk. So I heard how some families take like different routes that is like not on the highway to kind of prevent like any potential running into a cop and being pulled over, was one of the things I heard.
So I saw the question in the chat about policies, and Yesnely, you explained it perfectly. We didn't ask explicit questions in the quantitative survey, and that was more so explored in the qualitative aspect of the study.
Thanks, Yesnely and Lily, for offering that feedback. We also had just a statement and a question, and then I do see a hand that's raised as well. But just what can we do, as to help reduce these feelings for Latinx families? Earlier, when you all were just kind of sharing some of the stressors that are involved, and what are ways that we can educate the community and offer resources that are accessible to them. So really thinking about, as we were talking about, our next steps and future directions. And so wanted to know if you all wanted to offer anything with that.
I'd love to start with Carla sharing, because Familia already does so much. So I don't know, Carla, if you want to share a little bit about what you all are already providing, and then we can definitely talk about some of the next steps as well.
well, answering some of the questions or being part of the opinion that you have given, actually, being part of this collaboration is a huge improvement for the Latinx community, because I have a great regard with Emory University, and our clients being participant of this pilot study is a great, progress for us being part of this. So you get to know what's happening in our community and offering the process, this research process in Spanish for them. Okay, so thank you so much for that. And what we do in Ser Familia, we are a nonprofit organization in Georgia, and we have 4 different locations in Smyrna, Norcross, Suwannee, and Kennesaw. Kennesaw is our the newest one. And we offer mental health services that include counseling. And also we offer workshops for the family. And these workshops include parenting training, like PPP, Positive Parenting Program, and also programs for the youth. The name is Renovación Juvenil. Also workshops for couples, en relaciones saludables or healthy relationships, and also for families, strengthening families workshops as well. And we not only provide these services, but during the pandemic, we've been very involved in offering other kind of resources like food pantries, being a vaccination center, or also a COVID testing centers. And we also have been very involved in educating the community in terms of the COVID-19 pandemic.
Thank you, Carla. Yeah, I think that I will speak for myself, but I think the whole team, we were so humbled throughout the pandemic as we were meeting and talking about the study, just hearing all that you all were facing and managing. And yeah, I was inspired and humbled and honored to be partnered with you all doing this incredible work. And one thing I think is really important, it's sort of a next step I'm interested in, is how do we support community organizations and their staff? Because I mean, the toll of doing this work, right, in so many different facets, and then also having your own experience just is a lot, and so thinking about staff wellness, and I know we heard a bit about that actually in our process as well, but I think that that's just so important to think about, how do we support organizations like yours that are doing such incredible work on the front lines. And it's been such a privilege to be able to partner with you to learn more too, right? And how can we leverage our resources, like you were saying, being able to be partnered now to think about really addressing these complex and big issues. So thank you for that as well. Any other, sorry.
Yeah, I just wanted to add, I think one thing I've been really reading or diving into as my literature review for my thesis, and just this project, and honestly just learning every single day, was, while this is just a dream, right? Someone can dream, but I feel like the most long lasting change would be policy reform in some kind of form and way, because when we even look at DACA, while that is a policy that has some kind of, it's not perfect, but for some undocumented Latinx individuals, it really is a pathway for success. And if we can really look at our policies and see how they are personally impacting our undocumented and mixed status families, and how we can really either create them from the beginning or create new ones, I really think that's a topic to dive into when we're thinking about long-lasting change.
Thank you, Yesnely.
We don't have any more questions right now, but we do have a hand raised. Sharon has had her hand up, so I'm not sure if it's a question or not.
Well, yes, it's a question and a comment. So my question is there a way to determine how much of the depression exists from pre-migration? I know that families that have come to this country undocumented must have been experiencing such trauma and distress prior, to risk this. And it just would be very interesting to me to know, how much is pre-migration. There is certainly a lot going on post-migration, but I think it would be also interesting to determine the pre-migration and to educate our greater community about, the stresses that these families have faced. I think it's really sad. And I think this country could do so much more to help these families and also to provide, as you mentioned, a pathway to success, because we have so much talent being wasted. It's just something that needs to be addressed by policy.
Well, thank you, Sharon, for your question around the pre-migration. I think Yesnely could definitely speak to that, because that's one of her primary interests, is really understanding the pre-migration during and after, and thinking about also the intergenerational trauma. So Yesnely, I don't know if you want to say anything to that.
Yeah, I think, Sharon, like you're absolutely right. I think the way I look at it as like a cumulative trauma, because while the pre-migration is very important, like the migration itself, so like traveling from whatever country they're coming from to here has like a lot of trauma itself, like whether it's like going through a coyote or like whatever means it may be, that itself is like a whole nother trauma. And then obviously the after migration and like just having to navigate a place that really isn't built for individuals. So I think the best way of looking at it is like cumulatively of those three like trauma effects. I think while looking at that, individual who is like a first generation, like my parents are the ones who immigrated, right? And how their effects and their migration has affected me as a youth, and how that would be carried on to, my possible children, I think is a really aspect that hasn't been touched or researched yet. And really understanding the history behind it and how that may look like psychology, or looking at like the psychology of it, whether it be attachment styles or like negative coping mechanisms that kind of come out of the trauma itself that has not been treated for. Because while Said Familia does a wonderful job, like they're one of just very few that are providing these resources for individuals who are seeking mental health, as well as like, while I feel like Lily had mentioned it, I feel like mental health is kind of the smallest or the priority that's not looked at right away, because people are struggling to get food and to just drive children to work and to do all these things. So I don't know if that answered the question, but those are just some of my thoughts.
I would also like to add about the stigma that this family usually bring with them when they are immigrating. There's a lot of need of education about what mental health is and what mental disability is, or mental illness. In my experience, I've been worked with some families that they are not aware they are facing mental health problems. They've been in traumatic environments, in chaotic environments for so many years in their life that they are not aware of that this is an issue, or that's a problem with what's happening with them. And also a lot of stigma that they are not allowed to give themselves some compassion in suffering and depression. So they might say, well, I'm not feeling well. I've been, lack of energy, or I'm not able to sleep, but maybe it's because a lot of work, and they are not able to identify that these symptoms might be related to a mental health problem. Also, this is other topic, but spirituality as well, or religious values as well. Like if I am suffering from these changes in mood, might be because I deserve to be suffering this. In order to explore how is their mental health status before they immigrate, it is important to acknowledge how the stigma affects their way to see their mental health.
Thank you. And I just would add, just from a lot of my work is with folks that have multiple traumas and chronic stress. And I just want to echo what you all have said. And I think there's also like the survival, like I'm here to survive. It's not about like my mental health and this and that. And so really getting more aligned with what people's experiences are, understanding it. And I think we really have some work to do in terms of tailoring our services. And I think Familia obviously is doing, culturally appropriate services, but like Yesnely mentioned, how do we better resource those that are doing it, expand? Part of what we're hoping to do with the Promotora approach is be able to reach those that aren't going to come into a clinic because of like what Carla was just sharing around stigma. And I know someone brought up transportation, these different issues that can be barriers. And also that by having someone that can relate to you on multiple levels, right? Deliver the education and support. So I think, we're trying to think about different ways that we navigate some of these challenges. But it's really important, like what you're sharing, for there to be better awareness and understanding of it, and to know that it is complex, right? There's multiple layers. So thank you for your question, Sharon. And I agree. I think there needs to be more awareness and more action, for sure.
Sure.
I do want to highlight, just because I know we're talking a lot about trauma and stress, and that's obviously the focus and mental health and really preventing violence and child maltreatment of our work. But I want to highlight some of the strengths that we also saw, because I think that when we think about where we're going to build, it's going to come from the community and be able to build on those strengths. And so obviously Familia as a partner has been a huge strength in this study. I want to ask Emily, I see that she's on, if she wants to share anything about some of the policy advocacy, and she's working on actually an analysis looking at electoral policy and kind of how that impacts some of the things we've been talking about. So Emma, I was just going to turn it to you for a minute if you're willing to share a little bit.
Yeah, for sure. I think something that's really exciting about looking at policy is that we see that it needs to change, and the changes that have happened have been led by people who have been actively resisting sort of these policies in the community for decades now. So we see that happening. Some of our data shows that the electoral work that changed the sheriffs in both Cobb and Gwinnett counties were like, people were feeling immediate relief from that. And that was something that we saw in the in-depth interviews we did with frontline workers. They said, because now the sheriff in Cobb is changing or Gwinnett is changing, people are feeling more relief, like they're not going to be pursued so actively as they have been over the last couple of decades in those counties where they'd be stopped with routine traffic stops. And those came as a result of community efforts, of community organizing to be able to bring about those changes to the sheriff, door knocking, canvassing, a lot of like just trying to put the narrative out there in social media. And that really, I think had a big impact, and it's not studied as often, like that component of like community organizing and how it can bring about changes, even to like the health status of those who are participating in it, and then also to those who are like reaping the benefits of it. But we see that as Yesnely mentioned, like policy reform has to happen, that DACA brought about changes for people that were really huge, and there has been evidence that DACA did relieve like a lot of the mental health challenges in adolescents who benefited from it. But then it was also dreamers themselves, youth who were affected by these policies, who participated in bringing about that change, and so there's an interesting and underexplored part about how communities themselves are able to kind of steer the direction, even though when they're faced with a lot of hardship caused by policies and sort of systematic exclusion, whether it be locally or at the state or national level.
Thanks, Em.
We've had quite a bit of chatter in the box with questions, and Lily, thank you for addressing. I do want to make mention just to asking us how we created our guides, just understanding that there are various, when we have participants who could be from a variety of countries and how Spanish is used, how we created our guides. So I know you answered it in the chat, Lily, but if you could give a little bit more context to that. And then I think we have another question that we could answer to the panel, ask of the panel.
Yeah, so coming back to survey development, I think we were very cognizant about that, about different countries. You know, the wording might be different, although we all speak Spanish. It could be very different. So I think we were very upfront about that fact. So working with the Familia and saying, hey, these are the questions, how we laid them out. What are your thoughts? You're surveying the population. What would be the best way to ask? So they were also very honest in saying they won't respond, or this doesn't make any sense. And we were like, okay, let's fix it. Let's change it. So there were many meetings. It wasn't just a one and done. So I think it was very much an iterative process, and being okay with that fact for anyone looking to conduct a future study. So yeah, it took a little while, but we were very patient in the fact that we wanted to get it right. We wanted to make sure that the population understood the questions.
And I just want to add to that. I think, Lily, you were very intentional, even with finding when we were doing voiceovers, knowing not just translation of words, but the tonation and how accents can land, just very thoughtful, and thinking of that as you were building the survey piece as well.
Thank you, Tiffany.
Well, I just want to lift up how important that process is. And like Lily mentioned, how many meetings and being open and flexible to, obviously when we're using validated scales or certain questions we have to ask in a certain way, but even thinking about which scales we're choosing and why, and have they been has this actually been validated with this population, and what are the limitations? So I think that's so important, because one of the things, and I don't know, Lily, if you want to comment on this, that we heard, so we had an open-ended place for participants to kind of share anything we missed or anything that we didn't ask, and I'll let Lily kind of talk about what was shared, but I think it was really powerful. And what was so important is that you do create space for people to be able to share their experience and their story, and that you're thoughtful about that it's not coming from because I have a very different life experience. If I'm just setting a survey and sending it out, I'm going to miss a ton. So Lily, I don't know if you want to talk anything about what we learned from that open-ended question. I'm so glad that we had it in there.
Yeah, so we, like Briana said, we wanted to be very intentional in giving the community a space to also give us any feedback that they might have. And I thought it was really eye-opening, specifically that they were so willing to share so much of their lives with us in that space, in that open-ended space, because sometimes, you're doing a quantitative survey and you're like, I don't really fit nice and neatly into these little boxes sometimes. So having that open space, and some of the questions that came up as we were collecting this as well around the time of the presidential election was, thank you for seeing us, and thank you for conducting this study in a language that I understand. And also, participants were really happy. They're like, wow, Emory cares about me. So that was a little eye-opening, I think, for all of us. So I'm thankful that we added that last part in the survey. But I would also say, with our community partners, kind of thinking back to the process, we had debriefing interviews with Familia staff, since they were the ones conducting it in their offices. There was a lot of trial and error, and I think, thank goodness that this was a pilot, because we also learned a lot as we're also in COVID, and we might be with COVID for a little while longer. I think that we learned a lot from our partners in sharing, yeah, this didn't work. We don't know if we'll do this module in this way anymore. So also thanking them for always being transparent with us and telling us like it is.
Thank you, Lily. Another question that came up is, do we have any ideas on how to support children in families where there may be a high risk of abuse and neglect? And I know, Briana, that's something just in all of our community partnered work. We really think about resources on the front line that we may have to extend out. And I think that was the beauty of being with Familia, is that in-house, they really had those resources, but wanted to just present that question to the panel.
Yeah, Carla, did you want to start, or I'm happy to, but I don't know if you want to share a little bit, from Familia's perspective, what you already do.
Yes, I would say that parenting support, it is a great way to to help diminish the potential abuse in the family. And I am proud to say that we are working with that, with our family, offering parenting support in Spanish in their language is the program for them. And not only that, but we had weekly calls to the parents to help them stay, what is this word? Committed to the progress, to the process, in order to have, a great outcome in their learning on how to better parent in a more positive way. So I would say continue working with education to the parents and offering the support that they need.
Yeah, and I think also something that I've been and I think this will be part of our next steps, is thinking about all the work that you all are doing, Carla, with DFACS and with the school system, and thinking about more of a collective response, and how are we really, again, ensuring that we understand what the issues are and then are responding appropriately to prevent, child maltreatment, and also address it when it happens. And so I think there's a lot of work to be done, and particularly around the understanding. Just in general, I think we misunderstand these families a lot. And like you all were saying earlier, what all the stressors and all the things that are happening. But I do think there's a definite commitment to obviously wanting children to be safe and with their families, right? And with their communities. And so how can we all work together around that? With the promotor intervention that we're hoping to implement, that actually a colleague in California has developed that with a community partner, Latino Health Access. And they've been doing that in the community. And what they have seen is that it has reduced child maltreatment. So we're excited to, think about expanding interventions, but in ways that they're complementary, right? So not reinventing the wheel, but how do we build on the strengths and then continue to really address what we're seeing from the data and what's coming out.
Well, before we close, I know we mentioned earlier just ideas for future research, and there was a question just about, are there any plans to follow up with participants or interview new participants to see if general PTSD or depression states have improved, or stats have improved now that things are back to normal? I think that aligns a little bit with what Sharon was asking earlier.
So again, Colin, Carla, I know that you all already collect a lot of data in-house in terms of clinical data. I think that we are talking about next steps. Yesnely's project is really going to focus on this with youth. And so that's our current next step, because we did not have them included in the original pilot study. We really were focused on the parents and getting their perspective, on their family. And so now we want to get that youth perspective. So that's kind of our immediate next step of data collection for the research piece. But Carla, I don't know if you want to share anything about what you all collect and any plans that you all have to look at some of these mental health impacts.
No, I'm just excited about continue collaborating with you and all the research. And, we are very grateful to be in this position and open to offer all the help that you need in order to have great data that can explain and also help and find new resources for our community. So I am willing and able to keep collaborating with you.
Well, we're excited about that, because it has truly been an honor. It's hard work doing this. And so having partners that you really can gain and support each other is so important. So I think that's been critical, as we've all been going through the pandemic too, right? And so thank you for that, Carla, and thank you, Sir Familia. And I just want to also highlight, I have to shout out to the students on this project with everything else they were managing. Just the way, again, it was rapid response. We had to jump right in the summer, and the way they completely dedicated themselves to this work. I learned so much from them, and I'm humbled by them and what they contributed. And I just think the capacity to do this type of work requires these types of partnerships, and really letting people lead in the ways that everyone brings different things to the table, but the expertise that was really shared by bringing us all together was really powerful. So I'm just really grateful to be able to work with amazing students, amazing community partners, and I'm excited for what we're going to be able to do next. And I think we have just a couple more minutes. I don't know if there's any last questions, or if I should turn it back over to you, Sharon.
Thank you very much, Briana, for a wonderful presentation. And we're just honored that you are one of our pilot study awardees. and that you're doing this research in collaboration with IPRCE. So we think it's wonderful, and we really want to strengthen the relationships that we have with the Latinx community and hear more about what is affecting them and how we can educate our greater community, and especially in the area of compassion and understanding and resources. So thank you again. And if anybody has any questions about the injury prevention research at Emory, we have a website. Ashley, if you could put that website in the chat, that would be great. And we look forward to seeing you again at our next educational event. Thank you.
Thank you. And I do want to thank IPRCE for all your support of this project, and an iterative pilot. Not everyone will fund something like that. So that has really enabled us to get to this point to be able to, do these next steps. So thank you as well.
Great work.
Thanks, everyone.
Thank you.